I will talk about national healthcare services for hemoglobin disorders in Sweden. And as you know, the migration has been affecting a lot of healthcare systems all around in the world, in Europe also, of course. And Sweden is a small country and with a population of about 10 million inhabitants. And out of these, 2 million are immigrants. That's covering for a long period of time, but during the last 20 years, most of the immigrants have come from Middle East and Africa, and other countries, of course, as well, but dominating from Middle East and Africa. And these are populations where you quite often find people that are carriers of sickle cell anemia or thalassaemia and other hemoglobinopathies. So it's estimated, this is figures from the EU, that about 4% of the immigrants that we have are carriers of thalassaemia, beta thalassaemia, and hemoglobin E, and about 1.25%, or 23, very exact figures here, are carriers of sickle cell anemia, or hemoglobin C. Anyway, what has this led to? Well, if you look at this curve, I've contacted the Swedish Socialstyrelsen to get some updated numbers of patients with thalassaemia and patients treated in hospital or in outcare, at the outcare patient wards. And the number of beta thalassaemia patients, as you can see, from 2005 has increased from around 100 to now close to 700 in 2021. And for sickle cell anemia, it goes from around 100 to around 500 instead. These figures are, as I said, I just took the D561, that's beta thalassaemia major. So then we have the alpha thalassemias and so on. We don't have that in, those figures are a little bit insecure because when I added them together, I was up to around more than 1,000, but I'm not really sure how accurate those figures are. So anyway, this is the way it looks. Some years ago, I did the same, and then I looked at the different ages, and you can see here until 2015, this is for thalassaemia, beta thalassaemia. Most of the patients are young, and the numbers are increasing. You've seen that already. And most of them are young, but they're now getting up to adulthood. Many of these children are nowadays actually born in Sweden. As we have commented on earlier, we don't have any screening programs, and we don't have so good genetic counseling, so many of them are born in Sweden. Some years ago, 2018, Michael Angastiniotis, my Greek is worse, Angastiniotis and George, well, anyway, you see his picture here. Michael, you will hear him later on, and George Constantino visited us in Sweden, in southern part of Sweden, well, Sweden, mainly then in southern part and in Stockholm. And after that, they produced a charter of priorities for Sweden, and quite a good document with good information. And unfortunately, I heard that it is not actually available. It's still in the process of becoming available. Maybe I'm partly responsible because I'd made some changes to the Swedish wordings, but I never sent it in. So, but I hope that they're not waiting for that. Anyway, I hope it will be published because it's interesting. I'll come back to it later on here. But it's a policy recommendations addressed to the national authorities and outlining the policy gaps and ways to address them. This is the way it looks. You can't read this slide. I would take it part for part. But unmet needs in certain areas and what TIF recommends. If we look at the national registry then to start with. Well, we didn't have a national registry. We have the data that was reported that we can collect from the hospitals, but we don't have any official registry. So this was now, I've been working that together with a group of pediatric doctors and a few adult hematologists to produce a national registry, and it's a national quality registry. So that is something you can put any patient in. You just have to inform them, but they don't have to give informed consent. You just inform that we have a national registry, quality registry. As such, it cannot be used for research, and it cannot be exported to other countries. It has to be used locally. But it is for thalassemia, including the non-transfusion-dependent thalassemias or thalassemia intermedia, but not carriers are not in this registry. Sickle cell disorders, all with a disorder, but not carriers, and other transfusion-dependent anemias, such as diamond-blackfan anemia and pyruvate kinase deficiency. And the goal is then to improve and give equal care for these patients in all of Sweden. And it's sort of following up, how is treatment going on? How is chelation treatment going on? How is follow-up according to the guidelines that we have with the T2 star and all the other controls that we do? How is that done? And then that is registered. And as I said, there's a problem to export these data. So there are some in Sweden, a scientific study ongoing. So those that give informed consent, we could look at those data and do some research. And the same way we can export to other countries. And this registry is based on the data or the variables used in the European RRDeep, which is different than the TIF registry, because the TIF has a registry for thalassemia, sickle cell, some variables. But we have built this in together with RRDeep. So that is a European organization funded by EU. So they have money to support the servers and the work on this registry. And we hope to be able to export our data to them. So another problem that they found that was that education and awareness level among the patients and the doctors was low. And some patients, of course, had very little knowledge about their disease, and others had, of course, more, depending on what kind of educational background the patient had. And nowadays, I would say, we will find some patients that are very well informed, and they have found a lot of information on the internet and so on. And very happily, or luckily, I'm very happy that there is now a patient association for patients with chronic blood disorders, Patientföreningen Kronisk Blodsjukdom, KBS, who is part supporting this meeting here. And they have a good website where you can listen to a podcast about questions about not being alone with a blood disorder and so on, and quite good, and they have good information about different disorders and treatment of them. Besides that, thalassemia, of course, thalassemia organization, TIF, has a lot of good information on different languages. Of course, not in Swedish, though, but in different languages. And Svenska Blodcancerförbundet, the cancer organization, has a interest in blood disorders as thalassemia and sickle cell anemia. And Ona Sheriff, a colleague from Uppsala, who should have made this speech, I think, but he was not able to. And I myself is also participating in this information in pre-recorded that is available on the net. So there's quite a few information to get. Another unmet need was then about education and guidelines. And in that response, I think the TIF recommendations in these priorities, we had since a long time, about more than 20 years, pediatric guidelines for treatment of thalassemia and for sickle cell anemia. These are updated regularly. And in the adult world, there is also national guidelines for treatment of thalassemia. And we have had for a long time also guidelines for sickle cell anemia in pediatric side. And in the adult side, it's coming very soon. I've heard they are working on that one just now. So those are available for all one to find on the net. But, sorry, I think got a bit too quick here. We have also education meetings about these guidelines. Then something we also already been talking about a little bit, prevention and screening. There is still no screening policy in place for at-risk couples, migrants. We don't screen them for these disorders, but if there is anything in the blood samples indicating anemia, then they are screened, but not regularly. Refugees or asylum seekers. When a carrier status or if thalassaemia or sickle cell anemia is diagnosed, siblings and parents are screened, but we don't have any universal screening. Newborn screening is under discussion, has been for a long time, and now hearing from Germany, we could perhaps have use of your data to get this as something we can start with. The awareness of hemoglobinopathies are increasing, and many carriers are identified during pregnancy. And we have prenatal diagnosis is available, of course, and for those couples that are carriers, there is possibility of pre-implantation genetic diagnosis for these parents. Problem is genetic counseling. If we do screening a lot, you need to have good genetic counseling as well. And we don't have all those resources well spread for the moment. But of course, at the bigger university hospitals, this is available. Clinical management. Well, hemoglobinopathy patients are treated in the local hospital and are seen in the regional reference center annually at the university hospital. That goes for pediatrics. How it is in adult hematology, I don't know. I don't think they are seen annually at the university hospital. So it's a bit different. The reference center, the university hospital, could be a little bit better in training physicians and nurses working with these patients on the local hospital than we are. So there's something to improve. And there's also room for improvement regarding the transition from pediatric to adult care. That doesn't only go for hemoglobinopathies, it goes for many other disorders as well. Multidisciplinary care and reference centers. Well, patients, this is a statement from the TIF charter. Patients struggle to have access to state-of-the-art treatment and multidisciplinary care due to the limited coordination of services and poor knowledge of these disorders. I've already said that this is not totally correct, but there is still not so much of multidisciplinary care, I must say. And we had a very good presentation earlier today about that, and it was something to learn from, really. Education of health professionals about hemoglobinopathies happens at national meetings. I mentioned that before. And it is every year or every second year, as always, sickle cell anemia and thalassaemia as one point on the educational program. That's in pediatrics. Oh, I can't really say how it's in adult world. Information and consultation regionally by personnel at the university hospital. We are, as consultants, people, we call us from the other hospitals to ask what to do in this and this situation. But there is no policy in place for the university hospital to train the personnel of other treating centers. So we don't have to do that, but we do that. And actually, besides that, we have a network of doctors in the pediatric field that every second Wednesday discuss difficult cases, and many of them are sickle cell anemia patients, actually. So we have a team conference calling around from Sweden, and that we also, besides that, have a Nordic meeting with adult hematologists, and now I can invite some more adult hematologists to these meetings once a month as a Zoom meeting to discuss difficult cases. Mental health. Well, in the papers that TIF wrote, they stated that social isolation is the term best describing how patients feel, and that's unfortunately still true. Patients report feeling anxiety and stress regarding their aging status and what this means for their state of health. Many patients really feel alone. They don't meet any other patients with the same disorders. So what we have done and others have done, we have tried to rearrange the wards so the patients sit in the same room with seats instead of beds, because in bed you feel more sick, perhaps, and you can see each other. But the interaction has not become so much more anyway, but they at least see other patients with the same disorder or other blood disorder, because that could be a DBA patient at the same time as you have a Thalassaemia patient in this room. And in Stockholm, they've had a peer support group, I think mainly for sickle cell anemia for some years ago. I don't think it has been happening again, but they have been talking about doing it over again, I think. And in Lund, we plan to have a group for girls to meet with some activities. And not only sickle cell, with sickle cell, thalassemia, and some DBA patients that will do some activities, just to get to know each other and see that we have similar problems with chelation and so on. Counselors are available at all centers, but psychologists and that part, not so much. So in summary, number of patients is increasing, still no general screening for risk groups or newborn screening. National Quality Registry is established. Patient Association is established, the KBS. Guidelines are available, but information needs to be spread. Room for improvement regarding multidisciplinary care, genetic counseling, and the transition from pediatric to adult care. Thank you for your attention.